It's Dr. Janowski for Sonata. Today we're going to talk about mid-face volumization with filler. Mid-face is really important. So mid-face, we're talking about the cheek area. What we can think of the cheek as two areas, the front part of the side. And some people lose it in the front, some people lose it in the side, some people need a little bit both. And so we want to create or recreate that nice natural curve to the cheek without looking too cheeky or overdone. Everyone's always concerned about that. Don't allow that to happen. The lateral cheek really does help with lifting. The front cheek will more of that contouring. So in our patient here, we just see more of really a loss of volume in the front part of the cheek. She has a nice cheek all, but we can use a little bit in the lateral, but most of it really anterior or front so that we create a little bit what's called the apple of the cheek. We can see it when we smile, and then when we stop smiling, it flattens down. So women use a cannula technique, so we have hardly any pain or discomfort and hardly any, if any, bruising at all. It's a very quick treatment, easy to do. You can walk right out and go to lunch or whatever afterwards, and the result will typically last about a year. I'm going to use a Restylane Lift, which is a nice firm volumizing filler, good for deep injection. Want to be under the skin and provide the contour from underneath. So I'll show you how. I always do is add a little bit of local anesthetic. This prevents bruising at the injection site and pain. It's a quick pinch when I use a vibrating tool. I have the patient hold vibrating tool. These tools really distract from the pain and make it very easy. This is the only pitchy part. So what we're going to do is I'm going to put one, two on each side. A little tight pinch. Here it comes. A little pinch right there. And then we'll do one out here because we'll do a little bit in the lateral portion to knock her off. Here we go, a little pinch. Good. And then one out here. I'm just going to place a little bit of product in this area through this entry point that I've created, through the nose spot. And this is a cannula, so it's not sharp. It will feel a little bit funny. You'll hear some funny sound as it goes in. Alright, just going to inject that product pretty deep. And just bring up the cheek as we do it. So there's one there. Again, we're in a deep plane, just bringing up in the contour of the cheek with the filler. That goes in really quick. Okay. We're going to use over the cheek arch here. Same concept. We're going to use our filler. And we're just going to create a little bit more arch in the cheek here. Turn this way. Use our little entry point. Push our cannula in. And then a nice fur hyaluronic acid product. And you can see we just created some nice arch here in the cheek. Most of it was concentrated in the front, a little bit in the back. It looks very natural. No one would know she had it. And we can see that it's an immediate improvement in facial contour. Very natural looking. No bruising. There's really no active care. There's nothing to do. And she's good to go until it wears off. So that's the mid-face facial injection.